Good morning, everyone. Thank you for being here. My name is Maggie Emery, and I'm the Executive Director of Protect Minnesota, which is the only state-based, statewide gun violence prevention organization here in our state. We're gathered at a pivotal moment for gun violence in Minnesota. We must recognize the progress that we've made with the help of many folks up here while remaining resolute in our commitment to ensure the safety of our communities. The latest data tells us that gun violence actually declined by 6% from 2022 to 2023 in Minnesota, the first time since 2020 and the COVID pandemic that gun deaths actually decreased in our state. This is a testament to the efforts of policymakers, advocates, and community members, many of them standing here with me today, who have worked tirelessly to address this crisis. However, we can't ignore the broader reality. Gun violence in our state remains almost 20% higher than it was in 2019. Let me be clear, that is unacceptable. Every life lost to gun violence is a preventable death. We must continue pushing forward for meaningful and effective solutions. Work in this on the federal level is stalled, which makes efforts here in Minnesota on gun violence prevention even more important. I'm here to share with you our policy priorities for the legislative session this year to address this ongoing epidemic. This session, we're advocating for mandated safe storage of firearms to prevent tragic preventable incidents. We're supporting laws requiring the reporting of lost and stolen firearms to law enforcement to keep weapons out of the wrong hands. We're championing Medicaid reimbursement for violence intervention and prevention services, ensuring that proven community-based interventions receive the consistent funding that they need. And we strongly believe in the creation of an Office of Gun Violence Prevention at the state level to coordinate and lead efforts in reducing firearm deaths. We know that change is possible. It requires action, collaboration, and most of all, courage to stand up for what's right. That's why we're honored to be joined today by leaders who share this commitment and bring expertise, firsthand experience, and passion to the fight. First, we'll hear from Representative Athena Hollins, the author of the Safe Storage Bill in the House and a longtime champion for smart, evidence-based legislation that keeps our communities safe. Following Representative Hollins, we'll welcome Dr. Mark Gorlick, President and CEO of Children's Hospital of Minnesota, who will speak to the devastating impact of gun violence, the #1 cause of death for children and teens in this country, on the youngest and most vulnerable among us. Finally, we're privileged to hear today from Kiwanis Valea, Senior Program Director at the Metro Youth Diversion Center. Kiwanis will share his own story and insights into the critical role of intervention and prevention in breaking cycles of violence. We thank each of these speakers for their commitment, for their leadership and commitment to safe, more just communities. Together, through policy, prevention, and partnership, we will continue to move the needle on gun violence prevention and end needless, preventable deaths in all of our neighborhoods. With that, I'd like to turn it over to Representative Hollins.
Thank you so much. It's an honor to be here today. But it's with a heavy heart that I am here because we had an opportunity to pass safe and secure storage last year in 2024 and in 2023, and we were unable to get it across the finish line. Since that time, I started paying closer attention to the news, and I want to relate a couple of things to you. First of all, the leading cause of death among kids in the US is guns. Those guns are unsecured. Since the time that we adjourned session in 2024 until now, there have been at least 5 children that have been killed by unsecured firearms. A 6-year-old accidentally shot himself in Wabasha County in July of 2024. A 16-year-old shot his teenage friend in New Hope in September of 2024. A 3-year-old boy in Northeast Minneapolis accidentally shot himself in October of 2024. A 13-year-old boy in Minneapolis was killed accidentally in November of 2024. And in December of 2024, a 3-year-old in Otter Tail County shot himself while sitting in a car with an unsecured firearm. If these numbers were related to the measles or tuberculosis and this many children had died, it would be considered a public health crisis. It would be an epidemic. We would be calling the Department of Health and demanding that somebody do something. This is unacceptable. The state of Minnesota is better than this. In Minnesota, firearms are found in over 1/3 of households, with more than half of them unlocked and 20% stored loaded. And despite all the active shooter drills that happen in your kids' schools, the reality is the majority of children that are shot, almost 90% of those gun deaths happen at home. It is absolutely inexcusable and unacceptable for this to continue in the state of Minnesota. The reality is these deaths could have been prevented by a $30 gun lock. And I'll be honest, some of our members, the Republican Party in particular, and the NRA keeps talking about responsible gun ownership while fighting tooth and nail against common sense security measures like safe storage laws. The reality is the people who are in this building care more about campaign contributions than they care about taking care of the children of the state of Minnesota. As long as we choose gun industry profits over children's lives, blocking every attempt at these common sense gun safety legislations, families lose children to preventable violence. There are dreams of graduations, of weddings, of grandchildren that are violently stripped away because lawmakers remain beholden to gun lobbyists rather than working to address epidemic devastating our communities. This is easy. This is not controversial. I am a lawful gun owner and I keep my gun locked and my ammunition stored away from my weapon. The reality is we can do this. Minnesota can do this, and we absolutely need to. If we care about children, if we care about families, safe and secure storage is a no-brainer. Thank you.
Thank you, Maggie, and thanks, Representative Hollins. Thank you for allowing me to be here. Again, my name is Mark Gorlick. I'm the President and CEO of Children's Minnesota, which is one of the largest independent pediatric health systems in the country. You know, when it comes to kids and guns, I've been at this a long time. Back in the 1980s, as a second-year pediatric resident, I wrote an opinion piece in the Washington Post on this very topic of gun violence prevention. Because first of all, I was so upset at what I was seeing in my practice. And second of all, I thought people would be shocked to know that gun injury was the second leading cause of death in children. Here we are, almost 4 decades later. I am close to retirement, and I am appalled to see that this problem has only gotten worse. I mean, it's nothing less than appalling that the #1 killer of children in this country is not infection, it's not cancer, it's not car crashes, it is gun violence. Kids are shot at home, they are shot at school, they are shot in their neighborhoods. Every day of the week, a dozen children and teens die from an injury caused by a bullet fired from a gun. And day after day, we see headlines, locally, nationally, about injuries and deaths from guns. But the fact is, it's become so frequent, so seemingly mundane, that a child being shot to death doesn't even always make the news. It feels like, as a society, we've become numb to these tragedies. I have not, though. Because from my nearly 25 years of practicing pediatric emergency medicine, those children injured by gun violence that I cared for, they've stayed with me. I remember their stories. And because stories often have a power that statistics do not, I hope you will forgive me for getting a bit raw and graphic here, because this is some of what I've seen. I watched a teenage boy bleed to death. He was shot by a friend following an argument over a phone. And I watched his limbs swell up grotesquely from the fluid that we were pumping into his body in a desperate attempt to keep up with the blood that was pouring from the wounds in his chest and his belly. And then I watched his color fading, and the bleeding eventually stopped when his heart stopped. I saw a 7-year-old girl with pieces of her shattered femur sticking through her skin after a stray bullet went through her thigh while she was riding her bike in the neighborhood. I saw a 13-year-old girl who blew off most of her face when she tried to kill herself with her father's shotgun. And she came into our ER with one eye missing and the other dangling, and I heard her crying for her parents through the half of her mouth that remained. These kids that I've cared for, they haunt me, in part because I know every one of those was preventable. They did not have to happen. And we cannot and we should not accept the devastation that guns cause in children's lives and their bodies. I believe the way forward is for us to address the gun violence crisis as the public health crisis that it is, not as a political issue, not as a social issue, not as a policing issue, not as a moral issue, as a health issue. It is a health issue for America's children. And as with so many other public health crises that we have encountered, there are basic measures we can take, starting with policies like that laid out by Maggie and Representative Hollins that we know prevent gun injuries. Safe storage laws, laws that don't take away anyone's guns. They simply ensure that every gun owner safely stores them. They have been proven to save lives. And led by saying this isn't, or at least it shouldn't be, a partisan issue. Because in my conversations with many people, polling data show Republicans, Democrats, and independents alike overwhelmingly agree it is wrong for a child to be shot and killed. We all believe that. And too often we say, well, let's agree to disagree. No, let's agree to agree. We agree that that's wrong, and let's take steps to prove it. Let's take proven action to protect the kids that we all love from the #1 threat to their lives and their well-being. Thank you.
Good morning, everybody. My name is Kiwanis Valera, and I'm an activist for gun violence. Thank you, Representative Holland, Doc, and Maggie. My story is not no unique than a parent who has lost their child. The reason for my motivation of doing gun violence, because I lost my child to gun violence who was coming home from school. And getting that call was the worst call that I ever got in my life. Instead of doing something negative, I turned my whole life around and started positive things and preventing other parents from going through the same thing I'm going through. So now I work with over there on Franklin and Cedar Riverside as a national mind changer, and I have advocated and seen people and taken guns out of other people's hands, prevent other parents from losing their child. It is a dangerous thing that we are doing out there. We putting our lives on the line on a daily basis, and right now, to prevent another parent from losing their child, I will continue to do that work, and I'm also a single parent of 2 boys. So I'm not talking about the present, I'm talking about for the future, what their future may look like and what other kids' future may look like, to get out here to try to make some changes in these streets, because this is a ridiculous matter that the children that we're dealing with, the only thing they know how to do is pick up a gun. And where that come from misleadership. So we try to be positive role models out there on the street to have them guide, to pull those kids to the side that's suffering from substance use disorder, mental capacity issues, and other things. And they could be living in a broken home. So we try to give them some love and some capacity to show them, hey, you don't have to live that way. Some of the individuals that I deal with on the streets, man, they just touch my heart because I know they are lost souls. And every time I see a parent bury their child, I go through grief. I go through trauma. But it's not one day that I don't get up out of my bed to prevent some other parent going through the same thing that I went through. This is a tough challenge, being put out there, with not too much backup. And we are the gap between the MPD and the hospitals. We try to prevent it before it happens. And we don't get enough credit for what we do. It just takes for some people just to come out there to walk with us to see what we go through on a daily basis. It is traumatizing. It is hard work. It is dedicated work. And you don't know what it feels like to lose a baby. It is a tough challenge to put your child in a crank. And no, it don't make the news. I got the news before anything. It just go unsaid. But after you change your life around for so many years, to deal with that of losing your baby, My child was 13 years old, walking from school, and got shot 3 times in the chest. And the only thing I was able to do is pray. And I have lived that lifestyle, but I refuse to go back to that lifestyle. So I have learned to turn negatives into positive, and that's what I did on a daily basis. I prayed and I turned negatives into positives. Every time I think about my baby on birthdays, on Christmas and everything, it tears my inside up. But when I look at my 2 kids and we at the table praying before we eat, because I am a single father, I take care of my boys, I do laundry, doctor's appointments. I'm a positive role model. When I ask them who they want to be when they grow up, they don't say LeBron James, Kyrie Irving, or Michael Jordan. They say, Daddy, we want to be you. And that's how I motivate myself on a daily basis, through their heartbeats. I want to thank this panel. I want to thank everybody for coming out here to hear my story. But I don't have a unique story. I'm going to continue to be the Pied Piper I am. And I will continue to come back no matter if I have funding or not. I will continue to do what I'm doing because it's all in God's work.
And with that, we'll take questions.
The Medicaid reimbursement bill, I remember this from last year or the year before. Is there existing dollars out there that we're not leveraging? Is this using money or basically reallocating Medicaid funding for other public health programs too, and how does that work?
Yeah, so the way that it works is it would be a 90-10. State carries 10%, federal dollars carry 90%. So there would be a slight increase to the state Medicaid budget, what we're spending out of Medicaid already, and those dollars would have to be allocated. But we don't think, given the percentage, that it would be a very big burden upon the state budget.
But was the federal share, was that in that bill, the gun violence bill after Uvalde, or was that just existing money that we haven't taken advantage of?
It's existing dollars, yeah.
Are you concerned about potential Medicaid cuts at the federal level? And
Yes.
if that would endanger that program? Can you talk a little bit about that?
Yeah, absolutely. So we don't really know what's happening with Medicaid at the federal level, right? I mean, none of us know what could happen tomorrow, but that doesn't remove our obligation. We're a state-based organization, and it doesn't remove our obligation to push for changes here at the state level and to work with our partners at the federal level to try and move those Medicaid dollars. There's only a certain amount of control that any of us influences over what's happening at the administration at this point, but we have to keep moving forward with the assumption that the public health dollars that have always been there are going to continue to be there until we know any differently.
Are you seeing results yet from the gun violence prevention measures that passed last year on straw purchases and those other legislation?
Yeah, so in 2023, during the 2023 session, they passed extremist protection orders and funding for community violence intervention and universal background checks. Last year, we passed we made it a felony to commit an act of straw purchasing. We are seeing results from that. So we know that universal background checks, criminal background checks went into effect in the middle of the year in 2023. We did see that drop, that 6% drop 2022 to 2023 in overall gun violence. We know that last year there were about 140 extremist protection orders filed in its first year of implementation. So we know that this tool is being used on a pretty regular basis all around the state of Minnesota. In other states, those are data from other states tells us that for about every 1 in 5 to 10 ERPOs that are filed, a death is prevented for sure. Like, we can measure that. So we know that if it's 140 orders, that's probably, anywhere in the range from 7 to 14 deaths that were directly prevented last year, and that's just speculation based on data from other states. So we know for sure that these laws have been impactful in reducing gun deaths. We also know, you might have seen the story in Axios this morning, that violence is way down in Minneapolis this year. Many of the violence intervention organizations that were funded by state dollars got those dollars in the summer and fall of 2023. So they didn't have them last year when gun violence was up in the city of Minneapolis. They do have them now, and we've seen a reduction in firearm crimes and other types of violence in the first 3 months of 2025 when those dollars are in the hands of violence interrupters.
The safe storage bill was brought up, the House passed it last year. There was not the Democrat votes in the Senate. So I'm curious, maybe your Representative Hollins, what you think is different about this year, given that that makeup's still the same, and of course you guys have a tie now. The likelihood of it and why you want to bring it forward maybe despite the odds.
Yeah, well, excuse me. Great question. I think we have our values in the House, and we're going to keep bringing things forward that we believe are important for the people of Minnesota. And, I think when we look at this, we know that people should be voting for this. When it is polled with the general populace, it is popular. And so it's one thing, I think there is a disconnect a lot of times between what politicians do and what the general public wants. And so we need to keep bringing this forward. We need to keep having conversations about it. And as I mentioned, many children dying. Like, I don't know what can make people's minds change about this. I don't know how much blood needs to be spilled, how many kids need to lose their lives, how many tiny coffins need to be purchased before people recognize that this is a common sense, easy fix to a public health crisis. I'm yelling at you, but I'm not yelling at you. You know that.
You talk about your gun owner. I know you've heard the counter argument to the safe storage specifically, which is that if you are requiring a gun to be locked away with ammunition separated, if I'm a person who has a gun and someone is breaking into my home, that I can't easily access that weapon to defend myself. Can you respond to that?
Yeah, I just push back on that entirely. I mean, so first of all, I am a lawful gun owner. I don't think it's very difficult to unlock my gun and load it. I have a clip that's loaded, that's easy to put in. It's not difficult. But what I will say is, the reality is most people, when they use a gun, end up hurting themselves or hurting somebody else that they care about. I think many of my GOP colleagues would say that I live in a very dangerous and scary part of Minnesota on the east side of St. Paul, and I have never once had to pull my gun because I felt threatened by something. That's just not a reality for most people. And so I would say, so I push back first on the notion that even needs to be used that often. But second of all, I would say it doesn't take a long time. I know where the key is for the lock. I unlock it. I put the clip in. It's very simple. It doesn't take a long time. I mean, I would say I can probably do it in 30 seconds.
Can I just add one pin to that, which is that any good biometric safe that doesn't open with a key but opens with the fingerprint of the permitted lawful gun owner can be opened in less than a second. So in literally less than 1 second, you can have access to the firearm if the purpose of having that gun in your home is self-protection in the case of home invasion. So it's a fairly disingenuous argument. And a good biometric safe will run you about $100. So if you can afford a gun for self-protection, you can very likely also afford a biometric safe. Other questions? Yeah.
I haven't gone that deep into the Walls budget proposal. Is this funding protected in his proposal? Does anyone know?
Which funding?
The funding for the violence interrupters?
So the funding that was passed set aside $71 million over the next 5 years. So that is protected. That pot has already gone over to DPS, and it will be dispersed over the next 5 years with the original grants coming out last summer and fall.
I'm glad you have confidence that no one claws back money that's been set aside. I mean, they could do that.
And if they decide to, we will be very, very actively knocking down their doors to make sure that they don't make that option available. These are proven public safety strategies, and we really can't afford to stop funding them at a time when gun violence is 20% up from where it was before COVID.
Just to be clear, the Medicaid money that you're talking about in this proposal is not, it's separate from the violence interrupters. So it would be more like prevention in other ways? Because I know violence interrupters are considered prevention too.
Absolutely. So to clarify around that a little bit, so what these dollars would do is make certain prevention and intervention services conducted by violence interrupters, both street-based and hospital-based violence interrupters, billable to Medicaid as a public health strategy. So something like a referral into treatment, a referral into drug treatment, or a referral into mental health treatment right now is not billable to Medicaid. That's not a service that intervention providers can bill. That just has to come out of grant, contract, or other funding. That is a public safety service. We want that billable to Medicaid. Interrupting and mediating a violent conflict. So if there are two people who are in conflict, part of a violence interrupter's job is to mediate that conflict before it erupts into penetrative injury. That mediation would be billable to Medicaid. So it's a question of like these services that are provided every day that aren't currently funded by our existing public health Medicaid dollars would be billable by the organization to this Medicaid pool.
Do you know how many states do that?
I think 7. I think the answer to that is 7, but I would check me on that. I know Delaware does, New York does, California does. There's a handful of other states that do it as well.
I understand how an individual who's covered by Medicaid needs a health-related service. And just like a medical exam is billed to Medicaid, and that individual person who is covered by insurance could then bill this service through their health insurance. I don't get how an organization who isn't in and of itself a Medicaid client or a Medicaid patient could bill something to Medicaid. How does that?
Whew, you're really getting into my deep, dark knowledge of the healthcare system. Let's see if I can answer this correctly. So, organizations can become Medicaid providers, right? It's a very complicated process, but there are many organizations in Minnesota, hospitals, but also community-based organizations that bill certain services to Medicaid and get reimbursed for that. So, like a therapist might bill a visit with to Medicaid, something like that. So organizations can become Medicaid providers where they provide these Medicaid services, and in that case, the service that they provide is a Medicaid reimbursable service. Does that make sense? That honestly might be the extent to which I can answer your question because I'm a gun violence prevention advocate and not a healthcare advocate. Oh, Mark, please.
Just as an example. Yeah, just as an example, so at Children's Minnesota, we're a level 1 trauma center. So if a patient comes in who's a victim of gunshot, we provide the health care for them, surgery, resuscitation, all that stuff. We bill Medicaid for those services. Medicaid pays us. If now we then refer that patient to a program that we work with called Next Step, which is a hospital-based violence prevention program, and they go and get services from them. They get counseling, they get peer referrals, and so on. Next Step cannot bill Medicaid for those services. This would allow Next Step to say, okay, we're providing health services to this patient who was shot after they got fixed by Children's Minnesota. Now we're taking care of the next step in their healing process. They could then get reimbursed for those services.
Other questions? All right, I think we're all set. Yeah, thank you so much, everyone, for your time this afternoon.